Hey there! Did you know Baker's always gives you savings and rewards on top of our lower than low prices? And when you download the Baker's app, you'll enjoy over $500 in savings every week with digital coupons. And don't forget fuel points to help you save up to $1 per gallon at the pump. Want to save even more? With a Boost membership, you'll get double fuel points and free delivery. So shop and save big at Baker's today. Baker's, fresh for everyone. Savings may vary by state. Restrictions apply. See site for details.
Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked question that pediatricians regularly receive in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by no one. That's right. I'm going to be solo and share my expertise with you as a public health scientist. So today we are going to talk about the childhood vaccine schedule and why you shouldn't mess with it. The clock is ticking, so let's get to it. So I understand you've been reading about vaccines, you might be worried about the schedule, and of course it's always good to be informed. The recommended schedule is like a training plan for your child's immune system. It ensures that they get the right protection at the right time to fight off serious diseases. And delaying vaccines leaves them vulnerable for longer. And some vaccines, like measles, can actually be quite dangerous for young children. You should know that the schedule has been rigorously tested and proven safe. In fact, multiple vaccines given together are safe and effective. Your child's immune system encounters many more germs in a single day than what's in vaccines, even all the vaccines combined. And remember, vaccines not only protect your child, but also those around them who can't be vaccinated due to age or health conditions. So it's kind of like a community shield. And altering the schedule weakens the shield, putting everyone at risk if outbreaks occur. Remember that the recommended schedule is created by leading scientists and physicians at organizations like the CDC and other reputable places like universities and more. These scientists are constantly reviewing the data to ensure the best approach, to ensure safety and effectiveness of vaccines. If you'd like to learn more, I highly recommend checking out the CDC website, as well as the Children's Hospital of Philadelphia, CHOP, which has a great breakdown of the childhood vaccine schedule. But I want to answer some commonly asked questions. So number one, can multiple vaccines overwhelm the immune system? There's a common misconception that receiving multiple vaccines will overwhelm, weaken, or use up the immune system. In reality, alternative vaccine schedules have absolutely no scientific basis. Babies begin being exposed to immunological challenges at the time of birth. As babies pass through the birth canal, they're immediately colonized with trillions of bacteria, which means that they carry the bacteria in their bodies but aren't infected by them. Healthy babies constantly make antibodies against these bacteria and viruses. And the microbiome helps prime the immune system so that children can appropriately respond to pathogens, which are disease-causing microbes. Now, eating, drinking, breathing, playing all expose our kids to more antigen by many orders of magnitude than vaccines, even if all the vaccines in the childhood vaccine schedule were given at once. And in fact, extensive research shows that simultaneous vaccination with multiple vaccines has no adverse effect on the immune system. Recommended vaccines are as effective in combination as they are individually, and such combinations carry no greater risk for adverse side effects. Now, I just want to remind you all that everything we consume or put in our bodies comes with some risk. But when it comes to vaccines, based on decades of very robust evidence, the benefits far outweigh the risks. So why should you follow the specific child vaccine schedule? So CDC's recommended vaccine schedule is based on how the immune system responds to vaccines at various ages and how likely we are to be exposed to a particular disease. This ensures your child is protected from over a dozen potentially serious diseases at exactly the right time. The more you delay vaccines, the more time kids are vulnerable to infections from which they could be protected. Infant immune systems are stronger than you think. Based on the number of antibodies present in the blood, a baby would theoretically have the ability to respond to around 10,000 vaccines at once. Even if all 14 scheduled vaccines were given at once, it would only use up slightly more than 0.1% of a baby's immune capacity. And that capacity is purely theoretical. The immune system could never truly be overwhelmed because the cells in the system are constantly replenished. Babies are exposed to countless bacteria and viruses every day, and vaccines are negligible in comparison. Unless your pediatrician says otherwise, you should not skip, delay, or spread out your child's vaccines. Well, we hope you learned something today, and we have lots more to share. Remember, you can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
As a longtime foreign correspondent, I've worked in lots of places, but nowhere as important to the world as China. I'm Jane Perlez, former Beijing bureau chief for the New York Times. Join me on my new podcast, Face Off, U.S. versus China, where I'll take you behind the scenes in the tumultuous U.S.-China relationship. Find Face Off wherever you get your podcasts.